Demera's story brings to light so many important points. The first is to never ignore breast mass, even if you are 20 and pregnant. Most breast cancer is spontaneous and occurs in women over the age of 50. However, 10% of breast cancers can be hereditary and run in families. One of these hereditary breast cancers comes from a BRCA gene mutation. When they are mutated, they do not do their job correctly and can allow for replication of damaged cells that can lead to cancer. Women who inherit a BRCA gene mutation are at a much higher risk for developing breast as well as ovarian cancer. Around 12% of women in the general population will develop breast cancer. However, for a woman who inherits a BRCA gene mutation, their chance of breast cancer goes up to 60 to 87%, and their risk for ovarian cancer goes up to 20 to 54%. These increases are really quite significant, and so women with a BRCA gene mutation need to get early screening as well as close follow-up. If you have a family history of breast cancer, especially someone who was diagnosed before the age of 50, you should consider undergoing genetic testing. Thanks to the Affordable Health Care Act, BRCA testing is now considered preventative medicine and covered by most insurances. Even if you don't carry the gene, you may still have a strong family history as well as certain lifestyle characteristics that can put you above the general population 12% risk. It may also qualify you to receive early screening. So it's important to find a risk calculator to determine what your risk is. Women with a known BRCA gene mutation can undergo what is called a preventative risk-reducing surgery, such as a double mastectomy as well as removal of both tubes and ovaries. A double mastectomy reduces the risk of breast cancer by up to 95%. Obviously, nothing can decrease your risk to zero, but when it comes to cancer, a little goes a long way. Women who carry the BRCA gene mutation often are faced with making really difficult life decisions, and oftentimes at a very young age. Some of these decisions can include fertility preservation as well as facing early menopause. Bright Pink is an amazing organization that's geared to help educate women about the risk of breast cancer, as well as to support young women who have been diagnosed with breast cancer or carry the gene mutation. 15% of breast cancers were diagnosed because women were urged by friends or family to go in for a mammogram or to follow up on a breast lump. So keep spreading the knowledge. It helps, and more importantly, it saves lives. Thanks for tuning in.